welcome, everybody. Suze McCormick. I'm a partner here at MoFo, where I've been, believe it or not, for almost 30 years. Really not relevant other than when Ryan and Davida emailed me and said they needed space. I said, of course. And just a little bit of my background. And before I get into that, I want to say a couple things, because I have a few notes because I haven't had a lot of sleep. And the reason I haven't a lot of sleep is because we are expecting some executive orders targeting climate organizations tomorrow for Earth Day. And there are a lot of things that NGOs and corporations can do. I have to say, I know we have the former head of the Air Resources Board. I have never been so happy that I live in California, because we are certainly not going to backpedal. And there is a lot that can be done during this time. I think there are a lot of reasons for hope. I feel that this hour, only because I get the pleasure of introducing some of the panelists, but I don't have it every hour. But I think we have to remember, physics is not changing. The science is not changing. I was a normal corporate lawyer. I am still a registered Republican. Don't boo that. I left the party and I came back really to fight for climate on the right. I started my journey in climate in 2001. I had made partner. The economy had completely imploded out here. My husband had become a park steward in the Presidio, and introduced me. And it was like taking the red pill. I was like, holy shit, the world is going to completely change. And I know I was ages behind everybody else, but my father was a scientist, and so started reading Scientific American, and the evidence is just clear, and it's going to continue. And to some extent right now in this world, we just have to modify our language. I will tell you, my Weather Preparedness Fund is doing fabulously in all 50 states. It is climate resilience. And so you have to some extent, you have to meet people where they are. And one of the reasons I wouldn't have just done this for anybody and everybody, but one of the reasons I agreed to do this is really because of Aclima. And so I started focusing on climate in 2001. I think it was about 10 years before I saw the intersection between climate and racism and climate in our low-income communities, because I'm not politically correct. The rich whiteys are going to move uphill and everybody else is going to be decimated. And it is really, really depressing. It is not a business. It is unnerving for me. I mean, we go up to between 3 and 5 degrees. We start talking about losing a third of the world's population. And again, we're not talking about wealthy white Europeans or Americans. We're talking about the parts of the world that can least afford that kind of devastation, because they're already being devastated as we speak. And so when Davida and Ryan contacted me, it was my privilege and pleasure, because if you don't know Aclima, they have cutting edge technology. Number one, it's cheap. Number two, it's mobile. Number three, not only does it address climate, but it addresses health, because it circulates all over. It can circulate everywhere, but in low-income communities, to actually sense, to determine the air quality in those areas so that you can take and people can take action, which I just think is remarkable. Also, Davida set up her company as a PBC, a public benefit corporation. So she has a dual fiduciary duty, which can help her in many different ways. And for those of you who don't know, this is an and. She happens to be, in addition to running one of the best and most innovative companies, the first Latina woman to have raised more than $100 million of venture capital. So can we just take a moment? That was without notes, by the way. That's just, I'm a fangirl. She doesn't even know, I'm a total fangirl. But at any rate, did I say anything that Aclima wanted me to say? I have no idea whether I did or not. The other two organizations I don't know as well, but they are also appear to be just doing amazing things. There's Cedars Sinai, which is a nonprofit academic and healthcare organization that is really meeting communities where they are. I think starting in LA, but trying to provide the services that our communities desperately need. And there's also Watch Duty, which is a nonprofit, nonpartisan, non-government organization that is really focused on public safety. So I think I may have butchered that, but we do have a big practice focus in this area. We are happy to work with folks. Ben Fox, who is here, raise your hand, because this is not just a practice. This is really a focus area, and we are just honored to be here. Can I stop now? Okay. Okay.
Green button, right? Okay, there we go. I did it. Hi, everybody. I'm Boone Ashworth. I'm a writer at Wired. I don't know if I needed to stand, but she was doing it, so it felt right. I'm going to do the terrible thing of just making it about me for a second to explain how I got onto my climate journey. My climate journey started when the day that I found out the tooth fairy is not real. When I was a kid, turns out that my mom was collecting all of my baby teeth and my brother's baby teeth, and they were not being whisked away to a magical kingdom. And I found that out because I found the tin of baby teeth in the ashes of our house when it burned down. So my house burned in 2018 in the car fire. It was right before the campfire. This was in Redding, California. It burnt down 1,600 structures, killed 8 people, and unleashed a fire tornado in Redding. The main memory that I have from that incident was actually not the evacuation or any of the chaos that came after that, but was a week later when the ashes cooled down and we were able to go back to our home. And I watched my parents dig through the ashes, throw all the ash up into the air, have all of the stuff that had been their house. They just searched through it, trying to find something that they could salvage out of that experience. And what my mom found was the tin of baby teeth that she had saved. And it was sitting there where it had been for the past 20 years. The tin had melted away and the teeth were sitting there just in this pile and like this perfectly preserved little clump. And she went to touch them, and as soon as she touched them, they dissolved into dust. And I think that there are thousands of people who have stories like that. There are thousands of people in Altadena, in Palisades alone, who recently have stories of horror about dealing with fires and the aftermath that can linger years later after that. When fires burn things, the smoke goes up into the air, the plastics, the metals, the everything else spreads for miles. People inhale it, people breathe it. It affects people emotionally, it affects people physically. And I think it's important to look at the communities that are affected. Pollution is not a new thing. Pollution's been around for a while, but it is hitting this level of intensity with this climate era that we're in, and it tends to affect people who are poorer, communities of color, people who are disenfranchised. And so everybody here, as soon as I shut up, is going to tell you how we can try to fix that, or at least collect the data and help the people who are experiencing all this. So to start, I would say, let's talk about the problems. Let's talk about why this is an issue and then what we can do about it. John, I'm going to throw to you first because you are working on watch duty. I am connected here because I've talked to him a little too much. And I want to talk to you about the fires and what has happened, what has, in the current state of the Palisades fires and Eaton fires. Can you just talk a little bit about the chaos of that, the aftermath of it, and just like what it was like, I don't know, living through it, I guess, or watching it from afar? You don't have to stand.
Great. I'm going to sit. Thank you guys for having me. As Boone pointed out, I don't have my slides in front of me, but as we've all seen, mega fires and wind-driven fires are happening at an increasing clip. This didn't really happen until 2015 in the Valley Fire. And then 2016 and 17 and then 18, we had, the Zog Fire, Paradise Fire, and all these other fires that really drove from the wildlands into communities. And it's happening at an increasing rate. And they're not just wildland fires anymore. They're what are called urban conflagrations, when you get house-to-house ignitions, it's extraordinarily hard to stop them. This is a recurring theme. This was in Lahaina. We just saw this in Altadena. We've seen this in Greenville. We've seen this in Oregon, and it continues to happen, and it's going to happen at an increasing rate, unfortunately. Watch Duty is a 501c3 nonprofit, and we track all the wildland fires and their activity as they happen in real time. And so we unfortunately have a front row seat to the devastation that is happening. We listen to first responder radios all day and night, and that's how we disseminate all the information that comes to you in Watch Duty, because frankly, it is not very well tracked or understood. We're not even at the pollution part of this yet, but it is extraordinarily difficult to get to life and safety even during this event. For citizens as well as first responders, right? There's a lot of, I'm not going to go into too much of the Cedars Sinai work, but I have a lot of friends who are first responders who go through these urban conflagration fires, and they're inhaling incredibly horrible things: couches, car batteries, tires, ceilings, tiles, gypsum board, everything, right, is all burning. And it's really there's very little understood about all that yet. But I'm just here to be the dooms bringer here and let you know that this is going to keep happening. My app is free, and we're here to help you guys in your time of need. We'll talk more about that later, but the work that some of these folks are doing is something that we really want to share with the world in our product as we get bigger, because if you look at the air quality sensors right now in Watch Duty, it'll tell you that the air is fine in Santa Monica and Altadena, and it is not, right? Every time the dozer pushes ash to go clear a lot, it goes back in the air and is being inhaled by everybody again. So I'm going to pause there and pass it back to Boone here.
I would like to pass it to Susan, if you can talk more about that. So what you've been studying the effects of all of these particles going into the air and people breathing them. Can you just talk a little bit about that? Like what is happening? What are the problems that it creates?
Yeah, so I'll start by saying I'm a population scientist, cardiologist, treat patients as well as do research in large cohorts. We did this during COVID, ran a huge study on the COVID effects, the after effects, focused our study on predictors, metabolic predictors of healthy aging coming out of the pandemic. We didn't ever expect to be, we didn't know, because we're not experts like you all. We didn't anticipate that this terrible, devastating disaster really would hit our communities. It did hit our communities. And beyond the fires, the smoke, we started to see a real sort of first early warning signal of adverse health effects, sort of balloon into what I now call sort of the a still unrecognized, ongoing adverse health crisis. And we see it in the data. Our data are not published yet, but I can tell you in broad strokes that within the first 30 days of the wildfires, when we look at the data that really encompass, Cedars Sinai actually includes the largest acute care hospital in our entire area in the Western United States, particularly in California, our area, in Los Angeles for sure. And so we get a lot in terms of the ER visits. Obviously, there are other hospitals that got a lot of ER visits, but when we look at our catchment area, and we counted the ER visits from individuals coming from areas directly affected by the fires, the rate of respiratory illness, including acute respiratory failure, was 30% in excess of anything we'd seen on average in the prior 8 years. That kind of closely matched what you saw during the worst years of COVID, but it was way beyond everything else. And then when you took the 8 years of excess ER visits during the winter months, because they're always in excess during the winter months, and you look at something like acute heart attack, that was way in excess of everything else. So we saw 40% excess rate of confirmed heart attack. And that's even when you look at the bad COVID years and the bad influenza years during the month of January. That I did not expect to see. And, data person, work with data scientists, absolutely not normal, beyond normal. In addition to that, something that struck us, which we also did not expect to see, metabolic disorders. Metabolic disorders are when you show up in the ER, you feel unwell, there's something wrong with you, but you don't know what it is. And the doctor orders a bunch of lab tests, and there's something wrong with your lab tests, but also they don't really know what's going on, and they call it a metabolic disorder. So essentially the rate of people leaving the ER with a diagnosis of a metabolic disorder shot up 140, 150% in excess of all prior years. Again, well beyond the worst years of COVID, the worst flu seasons we've ever had in the last near decade. And we just recently looked at that data, extended to 60 days. The signal's still there through 60 days. And we see it, we hear it across. Our patients are telling us, I feel unwell. I can't put my finger on what exactly it is. It's not my usual asthma. It's not anything I've had before. And that's what we're seeing.
Yeah, thank you. Vito, I was going to pass to you. Okay. As far as, we don't have to get into solutions yet, but can you just talk a little bit about why you got into this space? And, you realize there were these problems that are being had. Can you talk a little bit about, whether it's wildfire journey or just, pollution in general? Expand on that a little.
Yeah, so thank you. I'm a lawyer by training. And when I was in law school, climate change was really starting to get a lot of attention. And I remember thinking, shouldn't this be illegal? This seems problematic. And I started kind of unpacking the laws that regulate emissions. And I went to the EPA, I hung out with CARB, I went to NOAA, and I discovered that the laws that were written, 50 plus years ago, hadn't actually kept up with the problem. And what had happened is that it's one of the few areas of the law where the law is tied to the state of technology. So basically, if you can't measure it, you can't manage it. And that presents a huge problem for the regulators, the EPAs, the CARBs of the world. I saw that problem and I said, I think there's a solution here. If we can actually improve measurement and start doing this at meaningful scale, we can give, this is like the naive lawyer, right? We can give the regulators the data they need to actually do what they need to do. And so then I moved up to Silicon Valley. I grew up in Southern California. And when I came up here, I was naive, number one. I didn't think that bias was so severe and it was impossible to raise money. And so I went to Google. And I told Google, I said, hey guys, I have an idea. They liked it. It took them a few years to kind of open up to the idea. But we started with indoor air quality measurement. And then later they said, okay, we get your idea. Let's do this. And it was actually Luke Vincent, the father of Street View, who's here in the room, who said, let's use the cars. And so he made a subset of the cars available to me. And that's how we started developing the technology to actually use vehicles to go to the site of emissions to take these measurements. Because one of the big problems with these measurements is that the model that exists today in the law requires stations, big, heavy stations, to be deployed. Each of those stations can cost a lot of money. And in the city of San Francisco, you have one monitor for the entire population. And so that is obviously not enough to make us feel like we're protected, especially when you have these kinds of events where you need much more data. And the thing is that that's an event where we can obviously do a lot more to generate more data, but it's very hard to do. And it requires, we happen to be living in a very kind of technologically advanced moment when these things are possible to solve. And so my team and I spent the last 10 years solving this, 10 plus, solving this. And the first step was really kind of, figuring out how to do this. The other part was getting the regulators to adopt it. And so just last year, we announced that CARB had adopted Aclima to do a major project across the state to measure pollution in 64 communities and to do it in a bottom-up, community-driven way that I think can really establish the model for where things can go.
Thank you. You've said CARB a bunch, which makes me realize that I haven't properly introduced Richard. Richard, you're an advisor or you're a partner at AJW right now. But before that, you spent 37 years at the California Air Resources Board. Can you just talk about some of the context here? Whether it's your role in that space, how you've been thinking about air quality, and just where how has society progressed on this in the time that you've been in this space?
Yeah, you bet. So when I began at CARB, my undergraduate was in toxicology, so I was interested in doing work on toxics efforts, regulations to reduce emissions. So started with CARB in 1985, working on regulations to reduce emissions of a whole range of perchloroethylene, methylene chloride, benzene, taking benzene or reducing benzene content in gasoline, whole series of regulations. But there were also a number of regulations focused on traditional criteria pollutants, NOx, PM, PM 2.5. And even when I'm thinking about this conversation, one thing I'm thinking about, because I think it'll be relevant as we go along here, is if you go back to the establishment of the California Air Resources Board, established a few years before EPA, there were subsequent significant amendments to the Clean Air Act that gave California unique authority to control established regulations for cars and trucks. We'll circle around that too with the new administration. But it was really focused on criteria pollutants, regional air quality ozone levels, national ambient air quality standards are established. PM and now PM 2.5 standards are established. The monitoring network, air quality monitoring network, was really constructed substantially around the characterization of regional air quality. Are we in attainment with the National Ambient Air Quality Standard, that ultimately is informed by plans. States, and particularly California, develops where are the emissions coming from, what's contributing to the formation of ozone, PM 2.5, and so on. What are the strategies to reduce those emissions? What does the monitoring tell us on a regional scale with attainment? Are we moving forward? And very quickly, then I'll connect the dots and stop. Back then, when the agency was established, California had about 16 million people in the late 60s, early 70s, 8 million vehicles, economy of about 150 billion. The number of ozone exceedances in South Coast, stage 1, stage 2 ozone alerts, multiples of the ozone standard, about 200 times a year, 200 plus times a year. Fast forward to today, and state has 40 million people, economy of over 3.5 trillion, 30 million vehicles if you include cars and trucks. We certainly have regional air quality challenges, but we haven't had one of those stage 1 and stage 2 for almost 20 years. That progress is undeniable. A vehicle today, well, we certainly have zero emission combustion vehicles, but a combustion vehicle is about 99% less emissions. That progress is incredible from a regional air quality standpoint. It's one of the reasons why representatives from states all around the country and the world, there wasn't a week that went by in my 37 years, especially when I was director, that someone didn't come by and want to talk about California's experience and try and model it. That's important, this modeling. But where I'm going with this is, in spite of that significant progress from a regional air quality standpoint, microscale, local air quality is different. The whole network isn't established to answer that question. It's a different issue. It's one that requires focused responsiveness and focused mitigation related actions. And it's a gap. And that's, I think, partly what we're going to be talking about as we build here. So I'll stop there.
I had my mic unmuted the entire time. Sorry. I want to talk about if we can drill down on the specific health issues, like who is being hurt by this, who is being affected by it. I mean, we all breathe air, right? Susan, if you want to talk about that a little bit, of just who is directly affected, who is the most prone to air quality problems.
Yeah, it's really interesting. What really drove us and our team into this, not only the personal effects, but when within the first 2 weeks we started getting calls from our patients, our colleagues, our baseline cohort study that we want to bring forward into this is healthcare workers and patients. We started getting calls from people who didn't have chronic conditions. We actually expected all the people most affected would be people with chronic conditions, right? People who are over age 65, they have chronic heart disease, chronic lung disease. They'd be the ones showing up in the ER with exacerbation of their chronic conditions. But a lot of the complaints actually came from people who were young or middle-aged, otherwise healthy, exercisers, people out running, not wearing a mask, not realizing that what's in the air within not just a few weeks, but literally now months, people are still, out and about, which they should be for their physical health, trying to stay fit, but not really paying attention to John's app or whatever data is out there to try to get a sense of what the air quality is. So these are younger, healthier, at baseline people who are actually having and sensing effects for reasons that they don't fully understand. So we're trying to help them connect the dots while measuring the data that are available. And I will say that I'm so grateful for you all on this panel and in this room, because as a physician, as a clinician, somebody who never got formal training in any of this, I was literally, on day 2, scrambling, trying to figure out how do we measure what's in the air? What is the best we can do? And before discovering these folks, I had my team running around placing HEPA filters around our building, in our homes, to try to look at how they were changing color, because they were all changing color so dramatically and dynamically within days, and then we were changing them out every week. And we're trying to figure out how do we measure the difference in how my HEPA filter is changing quality and discoloring where I live versus where my junior faculty lives, which is 250 feet in altitude higher up, and it's different, but he's closer to the Eaton fire. And we were just like, sort of dizzy with the confusion around how do we get more specific and location tailored data that will help us understand what's happening to people who are otherwise supposed to be young and healthy and not having these health effects. But it really does seem to be about where they live, whether a first responder or not, whether they were downwind or not. And we absolutely realize the need. We desperately need partners. We desperately need to understand this space so that we can start, just even begin to understand why these health outcomes, why these health effects have spiked the way they have and why they continue.
Yeah. Davida, this is a great time to throw at you and say, how do we do that?
It's a great question. It's really, really, really hard. What I'll say is, like Richard said, the current network is not designed to understand, the current network is not designed to understand these issues, because it was really established to understand regional attainment. Like, is the region in attainment with the standard? And what's happened with the increase in emitting activities and wildfires and fires that are urban is that the pollution has gotten so much more drastic. And what we now know, so something that we did with Google, we actually published a major study. And Brian LaFranca, who just walked in, sorry, Brian, reminded me of this. We did a major study in West Oakland 7 years ago. About 7 years ago. We published it about 7 years ago. That showed that pollution is hyperlocal, that it varies from one block to the next by up to 800x. That's a huge level of variation. And so, like Richard said, the regional monitoring network can't capture that level of granularity. And so this is where private sector partners can really come in and make a difference. And so we developed this methodology to get that hyperlocal measurement in order to understand that block by block difference. And it made a huge difference in West Oakland, where we identified black carbon, cancer-causing black carbon, as the most significant pollutant for them to focus their emission reduction efforts on because of its connection to cancer. You fast forward to December of last year, and they had reduced those emissions by 31%. They had reduced cancer visits to the ER, asthma visits to the ER substantially. And now, and after that, they were able to use our data to advocate for a major grant to electrify the port, because we discovered that the port was probably the largest source of black carbon, or of these cancer-causing particles. And
Sorry, when you say the port, you mean?
the Port of Oakland.
Oh, yes, okay.
Yeah.
Okay.
So, and it's a big project. It's a huge project that will result in really sort of a life-changing transition, right? For those community members that don't have to live with the pollution in that proximity. And so that's a big deal. But I think it points to the kinds of solutions that we're really looking to scale in California.
That's a great point. Richard, I was going to throw back to you and just talk about, maybe the history of it, but what do you see as challenges moving forward in this space? Or are there ways of, collecting this information and moving ahead with this?
A few things. One I described and Davida added to it in terms of kind of his traditional, for the most part, air quality machinery and what its purpose was and what its objectives. And I underscored significant success in terms of that it's undeniable, still challenges on the horizon. But the distinction between micro community level, what's the air quality in my community? How concerned should I be? And what's being done about it? There's a resource element. So one, there's a structural element in terms of, okay, how do you respond? What are the tools? Vita talked about the Aclima response is really important. And I think it underscores potential public-private partnerships that are really important in this space because it isn't fixed monitoring. It is high resolution, highly responsive, public relevant, but it also has to connect the dots between action. It's not just me telling you, hey, your air quality in your community is worse than you thought. It is what's being done about it. And at the end of the day, quality information can inform allocation of resources. How do you allocate those mitigation-related resources that you are much more tightly tied to impact and cost? Right, that to me is sort of the evolution that's playing itself out. There's never going to be enough money. There never is. And it's how are we allocating those resources as smart as we possibly can, and are we talking about this in the right way? In other words, traditional air quality, not exclusive, but traditional air quality and climate is often talked about dollars per ton. It's important. It's an important metric. But another one is, what's the cost of inaction? What's the cost of premature mortality? Avoided lost school days, lost work days, asthma. The litany of costs associated with inaction gets very short play in terms of what the economics are, and I think we all have a responsibility in that space as well.
This might be a Watch Duty-esque question, but how do we go about? I mean, this helps because everybody's here, so we can communicate about it. But how do you go about making people concerned about this? Like, I mean, yes, people are concerned about the air that they breathe, but how do you share this information with the public? How do you communicate it with people? How do you make people understand what is going on? I mean, I know Watch Duty has air quality monitoring in the app, but I'm just curious more broadly, like how do you have people care about what they're inhaling?
Well, it's hard being the messenger of doom, but I'll take that card for a second. I mean, we're sitting with scientists and toxicologists and doctors and people doing incredible amounts of research. And I think what was interesting was what Davida said is like, how do you make a metric for this and measure it and then get policy around it? If it's not measured, it can't be improved. And so what we are really is, I mean, Watch Duty obviously tracks wildland fires. That's what we do really well, but we're also starting to do other things and trying to figure out how to really show the world what is actually around you. And so that's the beauty of our product is we're engineers and entrepreneurs. We're not scientists and toxicologists and like doctors, but we've been able to get successfully into millions of people's hands and in the center stage of the world to be able to start to disseminate the work of people up here on this stage and others. And so that's really where we fit into this, again, as the messenger of doom. But if we don't get this out there, like it's just wild to me to watch my friends, like, half of them will live in Santa Monica and they're taking their dogs on the beach, and half are like, I am not going on that beach. I do not trust this. I can see the Palisades. All of the houses are being piled up at the edge of PCH, and then it's raining and going into the water. And the government says, you can go in the water. It's just like, that is absolutely not the case. And so unfortunately, it is our responsibility here at this group, but what Watch Duty does well is really shows everybody that reality. And so I'm honored to be able to share the work of such brilliant scientists and doctors and others to help bring attention to this problem.
I feel like it's a good time to look into the future, especially when it's such a chaotic time right now at the federal and societal level. And I'm kind of just curious, there's a lot of climate problems for people to worry about. There's a lot of things that people need to be concerned about. Maybe we can just go down the line here, but what do you hope for in the future, and how do you want to build towards that? And what are your, plans to save us all?
As somebody who treats patients and also, supposed to be running, population health research programs that are supposed to inform, public health policy in some way, shape, or form, we need data. We desperately, desperately need better data. So what we have right now is, thanks to John, his incredible app. And so for people who are aware, what they do is, and I do this, and folks I work with and who share the same knowledge do this. We wake up in the morning, we turn on your app, and we decide, are we going to go outside and take a run that day, or are we going to put on a mask as we even just walk to work that day? Am I going to make sure that the air cabin filter in my car has been changed recently and is a HEPA grade? And so forth and so forth. I plan my kids' weekend soccer activity around what your app tells me. I don't know if you know that. Like, will they go to their games or not? Are they going to do indoor sports, which means gaming, versus go outside and get fresh air, if the air is fresh to breathe? So I do that, and we are actually trying to educate our entire community, but it's hard because we don't have the data we need. And so some are, as you alluded to, they are trying to be careful and cautious around their health and their activities, and others aren't. So what we're doing now is we're, trying to, with the help of others and hopefully support of many, push our study forward and really try to track through surveys and through health metrics and every single health outcome we can actually assess today, where people are, where they live, where they work, what they're doing, whether, how they get transported, what their activities are, what mitigation tools, techniques, approaches they're employing, they're applying to their day-to-day life. And we would love to then map that and track that along with their health outcomes, because it is different. Otherwise, we end up with what we sort of have now, unfortunately, with COVID, is sort of a hodgepodge of people with varying degrees of illness from effects that we just don't understand very well because we were not able, not capable, we didn't have the technology or the tools or the forethought to try to measure this in a very precise way from the beginning. That's what I'm really hoping we can do. We learned a tremendous amount from our LAFD firefighters who are all about to enroll into our study because they know they are at the highest, risk from the extremely intense acute exposures they felt. They were talking to their colleagues in New York City, the folks who were first responders at the World Trade Center. There was a 10-year gap in their ability to start up a congressionally funded health research and clinical program for them. It was 10 years. And in that gap, huge information gap, a lot of information was lost, but also a lot of people just didn't make it to get into the study because they died. And so not only was that a profound loss of data and information, to the point where now 20 years after the World Trade Center collapse, you have estimates of risk that they look so modest. They're like, in my world, an estimate of risk of like 1.1, 1.2 is really modest for such a huge exposure. We don't believe the data. I mean, they are what they are. They're as best as we can do, given that they were able to enroll the 10-year plus survivors after that disaster. But we have a sense if we can do this now, starting now, not wait to not allow for there to be an information gap, not lose people along the way, we'll be much, much, much better for it and more prepared for the future.
That's great. Thank you. John, a question I've asked you probably 40 times. What's next for Watch Duty?
Well, I'm going to take all the time here if I go into that detail. Let me answer a quick one. Which is really beneficial to our community and what you were just talking about. But air quality is what's frustrating for me as a human who lives out in the woods is lack of understanding of my environment. And so it started with fires. But if you think about air quality, like it's frustrating. This is the reality. We're not living on Mars. We should be able to breathe our air, but we're here. So one of the things we'll be launching this summer is the ability to set your threshold for pain, quote unquote. So you can say, hey, Watch Duty, let me know when my nearest sensor is PM 100 and it'll ping you. So you don't even have to worry about it anymore, because really we want to optimize for time in life, not time in app. We're in the tip here of Silicon Valley, and that is antithetical to the beliefs around here, but we really don't want you in our app. And when you hear from us, it's because something bad is happening. But the idea of like doom scrolling, which all of LA was doing during watch duty, I don't know how we didn't fall over during that time, but it's not what we're built for. We're built for situational awareness and surroundings. And frankly, I don't want you to ever have to hear from me, right? My company, my people, my product, right? We do it because it has to get done. So that's some short-term thinking. Longer term, we don't think about just fire. We think about all disasters. So whether it's floods, tsunamis, tornadoes. I don't know if many of you guys were here for the recent tsunami, fake tsunami that happened. And so long story short is, similar to Altadena and other places, the alerting systems aren't built for this. They're not really run by a governing body who sees the issue and doesn't think about their borders and municipalities. So that small earthquake happened off the coast of Arcata, and next thing you know, there were alerts in Berkeley telling people to get in their Subarus and drive to higher ground. And then it was 25 minutes later to tell them, oh, by the way, there was a 5-foot swell. He lives on the coast. You can probably get your surfboard out and go have a good time. But our team, it's silly, right? And our team is looking at the ocean buoys, and you can just see every wave. And we're like, oh, there's the big one, and that was it. And get the surfboard out. And meanwhile, people are panicked. And so this issue is recurring other places about environmental challenges, and that's really where we're going. So I'm honored to do it and hope you don't ever hear from me ever again.
Famous last words. Davida, can you talk about the expansion and just like where things are going from here? Because you're Aclima is statewide now, right? Talk a little bit about that.
Yeah. So, and we're about to be statewide.
Oh, spoilers, sorry.
Yeah. So, but it's really exciting because I actually think when we think about climate change, when we talk about climate change as a community, we talk about it as a global problem, but all solutions are local, right? And all problems are local. And so if we localize our understanding of this problem literally on our home, on our block, it changes our relationship with the problem. It doesn't feel so big and abstract and impossible because it feels that way. And so I really think that the problem needs to shrink. It needs to get really, really local so that it's really, really personal because we're human beings. We don't do very well. Only a few of us think globally. Most of us think locally. And so I think that's the reason that this data is so important and why we're so happy to be partnered with the state of California, because we think that there's something magical there in that combination of governmental intention to protect the public and a technology that can actually deliver the data that we need. And so I think that combination over time is going to really enable us to do a lot more.
Amazing, thank you. Richard, sort of basically same question, I guess. I mean, you've been in this space for a bit. How are you feeling? How are you feeling about the future? How are you feeling about these public-private partnerships? Where are we going from here?
If I think about the most successful programs, so there's really been significant progress on traditional air pollutants in many areas, not all areas certainly. Been certain elements that have been common. One is clear targets, have to be measurable, in this case at a local scale. And I'm obviously speaking almost 40 years of regulator, so it's going to have some regulations in those targets and some consequences and enforcement. It's going to have a strong academic relationship in terms of underpinnings of research and data, always critical to inform action, and it evolves, right? You learn more tomorrow than you knew today, and you need to be able to adjust and adapt. And the huge role that private capital plays. I think that's often overlooked. Government dollars can play a role in catalyzing, but California, catalyzing to billions, I'm talking about hundreds of billions or trillions globally. The market needs to see opportunities. You actually want folks to see an opportunity for a return. That's where innovation comes from. Innovation comes from clear targets, at least in part. To me, connecting those dots, I always think about how do we connect those dots when we're talking about this particular issue. Clear expectations, measurable, community engagement, tethered to academic, to underpinnings of scientific data, and encouraging, facilitating, catalyzing private investment, which requires you can't move the goalposts. Right. You have to have clarity, because if there is a shifting of the winds, and obviously I'm making reference to the federal administration, You create uncertainty, it ripples through the market, and it's, wait a minute, I don't know if I'm going to put those dollars in that space. You undercut innovation, you undercut opportunity, you undercut cost effectiveness.
So the billionaires. We need benevolent billionaires. If anybody here is a billionaire in the audience, you know where to send your money.
Well, actually, we need local people. We need local people at home to care. And in order to actually reach them, we need to deliver that data in a way that touches them, that actually makes sense to them. Because, at the end of the day, these are my kids, these are my neighbors, and those are the people that I want to protect. And so I love the billionaires, but I don't think that they're essential in all of this. I think that the people that are essential are the ones that are at home suffering right now. Those are the people that are essential.
That feels like a great point to end on if I'm looking at the clock in the right spot. We had a few minutes for Q&A. If anybody has questions, I see a hand.
You want me to yell it out?
Yeah, or you could stand if you want, throw something. Should I? Wait, I can do that. That's what I'm here for, right? There you are.
Okay, thank you. My name is Stuart Mitchell. I'm a wildfire risk consultant in Sonoma County. So I know John from back in the day when he started Watch Duty. So I'm a big fanboy. And it was mentioned briefly around these are urban conflagrations. So the WUI is important, but it's really becoming an urban issue. So to Richard, the AQI is measuring mostly PM 2.5, et cetera, right? So we're not measuring benzene, we're not measuring plastics and all the things that are burning in buildings. It's vastly different to stand near a forest fire versus an urban conflagration, a garage, a Kmart, et cetera. So how do we get the data picked up through that for that issue? Because air is one thing, but there's also other kinds of air. And then there's, of course, the soil and the water.
I'll start, and then I think Davida is going to want to add. But just thinking about your point about toxics, I want to start there. So I talked initially about criteria pollutants, and there's a network of over 200 monitors, fixed monitoring, very specific site criteria, regional air quality that are intended not to be near a source. That's by design. There's a toxics monitoring network, but 24 monitoring between air districts in the state, a range of metals, organics, a few dozen, fixed monitors, not responsive to local issues. They're not in communities for the most part. And there is a significant time delay, particularly for metals, in terms of the availability of that data, and in terms of the form that data is provided. Pretty opaque from a community and common person to understand what it is, what it means, how to interpret it. This is to me where the gap is, and it's the point that Davida touched on in terms of high resolution at a community level, pollutants of community relevance with short turnaround times, communicated in a way that's relatable and understandable and ultimately informing action. It is getting into the community at high resolution. That's why I think the whole conversation of the Aclima platform is different than the construct of fixed monitoring stations, which serve a separate purpose.
And so to sort of piggyback on that, we measure all of the things that the CARB measures, but we also measure, so in our platform, we are measuring all the air pollutants. We're also measuring all greenhouse gases, things like methane and ethane. But then we're also doing targeted mapping of air pollutants for metals and toxics and all of the things that Richard was talking about. Those things are extremely difficult to measure, very difficult. It took us a long time to figure it out. And we actually have like a multi-step process because we do block by block mapping, and then we have an indicator that tells us this is an area where you should go measure heavy metals or toxics. And that combination, being able to combine those two approaches, gives us a very robust answer to the question of are there toxics here? And so that is critical, I think, to the future and critical to the ability to answer these questions.
Anybody else? Oh, see a hand over here. Hang on, I'll come to you. Sarita, hi. There you are.
Thank you so much for this. I was super excited about this event. I actually emailed like 5 times to get off the wait list. So whoever responded to those, thank you a lot. I'm working on a startup called Air Vitalize, and we're capturing outdoor air pollution to create targeted healthy spaces outside. So not in the wildfire space quite yet, but starting to deploy pilots. But a question that I get a lot is, what can you do when the air is bad? And so I know some folks who decide not to check the air pollution because they just hyperfixate on it, feel really depressed. They can't do anything but stay inside. So they might as well just go out and be in it. And that's something that, our vision is there's somewhere you could go when the air is bad, but we're not there yet. And it'll be a while before getting there on a global scale in combination with policy. And so just curious what you might want to tell those people and how, if there's any things that I haven't considered yet on what you can do during those times. Thank you.
I guess I can take that only because I get it a lot, but I don't always have the answer. It's funny because this was literally within a week or two after the fire started, and I remember there were all these school meetings. My kids are in elementary school, and parents would come up to me as if I had all the answers, and I clearly, these guys have more answers than I do. But I remember one parent saying, I'm really struggling with my son. He needs to get out, exercise, play team sports. But, do I worry about his mental health now or his risk for cancer 20 years from now? I'm just struggling with this issue. And, we all struggle and we don't have the answers. What we have done is we've advised our patients and members of the community to really try to stay as self-informed as possible. Don't expect that your local expert, whether it's your physician or your public health official, has the answers, because chances are they're just as lacking knowledge because we have no data. That's why we're here. So just as lacking knowledge as you are. But there are tidbits of information and guidance out there. So what we've done is we've put together sort of not really a manual, but sort of it's more of a slide deck and talking points for our patients and our community members. And that's around, what type of HEPA filters to have in the home, what types of masks to consider when you need to be outdoors, how to, in LA, we spend a lot of time in our cars. So, how to ensure that the air cabin, filter in your car is not just the one that came with the car, which typically is not HEPA grade, how to check it, how to exchange it. But, for individuals who have been struggling, particularly those with chronic pulmonary issues, asthma, chronic lung disease, how to have that safe room. And that's actually really important. It's the room where you sleep. It might also need to double as the room where you work if it's your safe air room for that period of time, whether it's because of wildfire or the air quality is bad for a number of different reasons. We've seen, again, we thank this guy all the time because we're watching his app and all the other pieces of data we can get online and through our devices. All the time we see the dynamic fluctuations that come from changes in the humidity index, from which way the wind is blowing, the temperature drops and falls, and it's not predictable. At least to me, I'm without meteorology training or toxicology training, I can't predict when the AQI or whether it's the PM 2.5 or other metrics are going to dynamically change along with all of these different factors that contribute to our living environment. But yeah, safe rooms we talk about safe rooms a lot, especially for those who suffer a lot of allergies and did a baseline and we're already thinking about air quality way before COVID, way before wildfires hit their communities. That's where we're at right now. I would love to be able to say, certainly if there are people who are particularly susceptible to ambient air exposures in an inflammatory sense, there are medications that can be prescribed, and there are certain medications that people can take. But that's really just, I tend to shy away from, that's sort of the trying to manage the after effects sort of an approach. We're much, much more proponents of prevention if at all possible. Try to prevent the exposure, minimize the exposure if at all possible.
Yep. Hi. Lydia? Okay, Here you go. Hi.
Hi, Lydia. Thank you so much. So I'm working with community health centers. So they're often serving uninsured or folks on Medicaid or Medi-Cal. And so I think something I'm really curious about, right, is that education for providers. And in particular, right, we're seeing that data isn't being coded around how people are coming to the emergency room, maybe because of a heat stroke. It's heat related, it's related to extreme heat, or it's related to wildfire, but that never comes through in the public health data around it afterwards. And so then it's really hard, right, to communicate. So maybe we do have the health records, we do have that data, but it's not coded in the way that helps communicate around it. So I'm wondering if you have ideas about who to educate to help change that.
You're absolutely right. We need informatics specialists who really care about this problem and want to get to work, to be honest. So within weeks after the fire started, MMWR, which is the publication that the CDC used to more regularly put out and sort of picked back up on sort of around the time of the fires, actually, they published a report that was put together by county officials, people at the LA County Department of Health, and they did the best they could with the data that was available with the expertise that they had. And they essentially counted ER visits across the entire county, and they saw that there was an early, really, really sharp spike in ER visits related to wildfire-related conditions. And in part, they were using codes. There are actually medical codes that an ER doc can use if they so choose to code that this illness for this patient I'm just treating and about to discharge was wildfire-related. I can tell you, if you were to survey 1,000 ER docs and ask them if they're aware of these codes, I'd be surprised if even one of them said, I'm aware that there's a code that I can use when discharging a patient to document that their illness was related to wildfires. So drastic undercoding or underuse of medical codes that are supposed to capture these issues is one. And two, every ER and set of providers working that ER, there's cultural differences in how the ER docs work in my facility versus at UCLA or USC or at Stanford or at Harvard. All the ER docs are used to seeing certain types of medical conditions come through their front doors and coding them in a certain way to meet regulation locally as well as federally and for billing purposes and so forth. And so a really good informatics specialist can understand the patterns of that coding and can, from looking at data accumulated in that particular ER and that health system over time, they can do the really hard job of picking up signal of something unusual that really isn't supposed to be there. So that's what we did with our data, which is why we were able to say, despite what was generically reported across all ERs in LA County, there being an early spike and then everything got better and looked like it, ER visits actually went down over time because people are still evacuating and trying to get their lives back together. Yes, people were not going to go to the ER unless they absolutely had to, but a lot of people absolutely had to. And those conditions were getting coded very generically. And so if you weren't looking for signal amid the noise, you were not going to see it. And that's why we need the informatics specialist to look at your data and then be able to inform your particular patient population how to manage the risk around whatever signal it is that's going to emerge from that data.
Thank you. Anybody else? I'll keep going until they tell me to stop. So I see you over there. I'll come to you next. I saw you too. There you go.
Hi, thank you for the presentation. Really important topic. I had a couple of quick things, so I'll just go down the list here. John and Dr. Chang, I don't know if you're familiar with Climate Health Now, the NGO organization. They've been very effective because it turns out that white coats showing up at city council and county supervisor meetings have a really strong impact. And since we're talking local and hyperlocal, I know that they're being very effective in that regard in getting people, doctors and nurses and people with other medical researchers up and talking. It has an outsized effect at those levels. And certainly from an information dissemination standpoint, they could be part of that. There's certainly other climate organizations, 350 Bay Area and others here and around the state that would be happy and excited to disseminate this kind of information in the communities that they operate in. And they do, again, focus on local. For Davida and Richard, I was really struck by a couple things. One, your comment, Richard, about clear targets, measurable, strong scientific foundation. That was an excellent distillation of what needs to come forward and be presented over and over and over again. And one of the pieces of information that's really not coming across, and also, Davida, you mentioned the necessity right from the get-go. If you can't measure it, you can't manage it. And one of the pieces of information that's not really coming across yet has to do with greenhouse gases, and that is that they're all put in on a 100-year GWP analysis. So most people consider methane to be 28 times or whatever more potent than CO2, but that has nothing to do with what actually happens when methane's in the atmosphere, when it's 80 times more potent, or 86 if you look at the GWP 20, or even more potent, 100 times more potent when you're looking at its first year of emission. And it's important to get that information out too, because the state has 2035 and 2040, 2045 target goals, but uses information that undervalues methane and leaves out black carbon and leaves out tropospheric ozone. And you've got this beautiful crossover technology to do measurement. And I think that bringing these messages home is an important, that you're simultaneously addressing climate change and local health issues, that you can build them into timeframes that people are planning around, not, this abstract 100 years in the future kind of analysis. The state has, of course, this short-lived climate pollutant strategy, but it's not integrated with the carbon footprinting and emissions and policies. They're different on different paths. And there is a way to integrate this. It's something that I've been working on with colleagues over the last 2 decades using IPCC published data. And we have protocols where we can integrate and help people understand the benefit of mitigating black carbon, tropospheric ozone, methane from now to 2030, from now to 2035, from now to 2040, in timeframes that people can understand, human scale timeframes.
I was just going to say, in response to that, one of the things that we've identified as a major opportunity is that people really care about things like methane because it explodes. And I'm sorry, but if it happens at your house, you're going to care a lot. And so when you can make it really personally relevant, I think it changes the conversation.
It's a great point. I'm just going to keep this going, pass this along here.
Great, real quick. I love data. I was curious about the data to action link. Davida, you glanced over this 30% reduction in West Oakland. I would love to double click on how that happened. Other panelists, what is your ideal data to environmental improvement feedback loop look like?
And that's a great question, because there's a massive gap between scientific expert data and action. Because the action typically has to happen in communities where there may not be any capacity. And thanks to laws here in California, like AB 617, that have set up a lot of capacity infrastructure, people now know what these things mean. And so in West Oakland, one of the things that they did was organize around a process. And, I think it takes special people to actually take this on. And in West Oakland, it was Miss Margaret Gordon, who was a local advocate who was should not know as much as she knows about this, but she does. And she took this on and she worked with the regulator, and they actually shaped a massive emissions reductions plan, this really wonky thing, right? And they came up with a plan to reduce emissions through 60 or 70 different interventions. And they're implementing it. I think it's halfway through right now. But it took somebody like Miss Margaret, it took somebody like, Brian Beveridge, the people in that community to take this on. But those are the people that actually set the template for us, and we can now go replicate that. And that's what we're going to do in 64 communities across the state to start. But ultimately, right, we want to kind of create the tools to enable anybody to participate in that process and reduce emissions.
I've been real unfair to this side of the room. Who has a question over here? Oh, I saw a hand. Okay. Oh, hey, there you go. Okay.
Hey, Dick Steinberg, Vector Climate Group. We build bespoke early warning systems. Up to about a month ago, I used to build warning systems for USAID. Now I'm back here in my home state building them here. And one of the biggest challenges is last mile delivery. And I wanted to hear how you're addressing that. And also, knowing that those communities aren't getting the information and they're the ones that need it most, what kind of feedback systems are you building in to track how they're responding to those alerts? That might be best for, well, whoever wants to take it.
Watch duty can take that one. Last one. Do you want to start?
Yeah, it's a good question. I mean, the interesting thing about Watch Duty is that, Watch Duty has been avidly used in these very, very rural areas like where I live and much farther away. It wasn't until the celebrities found out about it that people in this room knew about who we were. But if you go up into Siskiyou County, they have 40,000 residents. We have, almost every one of them has Watch Duty on their phone. Right, so we're deeply populated or penetrated in these communities, and that's very much by design. Right, we're reaching people that are unreached and unheard, and we hear from them. Right, they will write us usually a handwritten letter, and they'll tell us that they have 0 apps on their phone but Watch Duty. Here's $5, and it's really quite a beautiful thing to reach people that just don't get service. Right, Silicon Valley, I have 5 ways to get an app, get an Uber to my house or whatever, a Waymo. And up there, they're like, man, my insurance screws me, the power goes out and there's no one there for me. And so that's why we built what we built, to reach that audience. And so we've reached them successfully. There's obviously more to do. It is challenging in areas where people don't have cell phones, which still exists, believe it or not. We do work on web browsers. There are people with a landline and service of the internet. And so it's a really interesting conundrum, but we're also kind of trying to figure out how to skate to where the puck is going. Because if you look a few years from now, we're going to have direct-to-cell service. And so we're also trying not to get mired in the past and looking towards the future and saying, you know what, like we have people who are actually using GMRS radio, which is pretty big in our communities as well. And there are people who are broadcasting, they're reading what they hear on Watch Duty and broadcasting it over GMRS. And what we're trying to do is like enable that to happen, but also not building technology that we know isn't going to matter in a couple of years. And so it's a fine line. I don't have a clear answer, but we are thinking about it, obviously, and it does affect, my neighborhood. I live off the grid, for example, right? Everything I have to create on my own. And so it's very near and dear to my heart to reach these people.
We got any more? Yeah, back there. Okay.
Hi, I'm Bobby from PreventWildfire.world, and loved thinking about the cost of inaction from the perspective of tragedy of the commons prevention, Eleanor Ostrom's narrative of that. If we have per capita dose of wildfire pollution exposure causing a level of death and illness for people who are working for Fortune 500 companies and where the companies are liable directly as captive self-insurance for those costs, then we could get them to pay for more of the community risk reduction. But the question I'm trying to understand here from the panel is that we have some of this data in international context. We've looked at the Spain wildfire pollution data and Portugal wildfire pollution data and Australia wildfire pollution data for health risks that they measure, because they measure it in different categories. They've done some of the relabeling of what are all the conditions that are showing up in the hospitals there. And to get that here, we would need a Fortune 500 company or multiple to say, okay, we'll look through our last 25 years of data and look at how much we've had extra heart attacks, how much we've had extra strokes when there have been wildfire surges, and how much has that cost us. But when we talk to the Ernst & Youngs and the people who run the captives, they say that the companies don't give permission to look at prevention or the health data for wildfire to prevent it. And so then the companies aren't even really aware that they have the data of that kind, even though they do, because they're captives. They're required to keep it for many years. So question of how do we get the largest stakeholders that are in the greatest position to act for community prevention, pay for increase in beavers and goats and advanced technologies of various kinds. How do we get them to use their own data about their own people's wildfire pollution harms to make actionable Eleanor Ostrom style tragedy of the commons prevention in community by bioregional or air basin, fire basin, water basin risk reduction?
I'll take that real quick, and then maybe Susan, you could speak to this too. And I can't say that I know the answer, but I do know that we as a society severely undercount the cost of inaction on climate. And I think that the area where it shows up is health. because we are not tracking those impacts, like Susan said. And, and I think that actually is a huge opportunity, and I have not figured out the policy framework for this, but I think it's a huge opportunity. Susan?
There are clearly connections, there's no doubt, right? I think everybody in this room would agree. We have to work harder, all of us, we have to crowdsource our resources, our expertise, our technology, and our ability to innovate to very clearly connect these dots. The dots are there, they are connected, but we have to literally do what we can and figuratively take that really big black Sharpie marker and bold the connections between these dots, because they are connected, but it's up to us to sort of bolden those connections. And it's happening on I think micro scales in different places in different areas. There's, reportedly there's a new, sort of fancy office building that went up in New York City that's a very clean air building, and that was financed by a big finance organization because they recognize that if the air quality in their office environment is not the cleanest it could be, it actually it negatively impacts the cognitive performance of their workers and leads to absenteeism and poor work performance, so they can't be as competitive in their particular sector of the financial market. So connecting those dots, that's just one example of dots being connected. But then, you're right, a lot of large companies have their own employees' health data. They actually don't know what to do with it. I've actually been asked to consult for some of these, even healthcare companies, even pharma companies who they employ thousands of employees, and they actually, for instance, they will study and develop a drug for heart disease or metabolic disease, and they've now figured out they need to turn around and take care of the health of their own employees, and they are asking for external advice on how to study the health collected on their own employees, and they're in the healthcare sector. So I think there's disconnectedness between what needs to be done and the experts who have the experience and the know-how and sort of the knowledge, the domain knowledge to help connect the dots. But that's why I'm at a conference like this, which I never would have ended up being at if you'd asked me a year ago. I wouldn't know how to connect the dot, but now I'm here. So I think we have to all figure out how to reach across. It's not even about reaching across now. This is like reaching across sectors, reaching across areas of expertise, reaching across industries, reaching across cultures to try to communicate and have these discussions and conversations and connect these dots.
And I also think that if we can make a financial argument for actually intervening in this issue, in the state of California, as an example, the California budget is being hit really hard right now because of healthcare expenses in these communities, because there's such higher pollution, because of there's a lot of other issues that are compounding. But it's definitely a contributing factor in a huge way, right, that these communities are experiencing such high levels of local pollution. So I think that if we can connect the dots, we can help to make that happen.
That was great. How are we doing? I see hands. That's how the room gets first dibs now? Okay, all right. See if I'm right here. I'll come back to you. No, it's on green. I think it works.
Hey guys, my name's Emmy. Hey John, how you doing? I'm the CMO of a disaster recovery company. We're called Bright Harbor. We provide case management for disaster survivors, help them navigate the financial aspects of being a survivor. I just have actually a really interesting question, I think maybe for all of you guys. Right now, of all of our survivors that we're currently working with in LA, we are seeing everybody concerned about toxicity. And everyone is getting different readouts on toxicity, whether it's they're getting that directly from their insurance company, vendors that their insurance company is asking them to use versus people that their neighbors are using, and they're all seeing completely different things. If any of you experienced a wildfire, would you guys move away from your house or would you stay?
Well, I'm going to answer that question because I've had to fight fire in the middle of the night, mostly mop up. But I've been through several fires and I decided to stay and fight and build watch duty. So my answer is very short and clear, but it was a calling for me to do something, not to give up on the state that I love and brought me so much. So it's important for me to stay and solve a problem.
I think the same. It calls on you to do something to solve it.
How would you think about it from a toxicity standpoint, if it affected you personally? I mean, obviously it did affect you personally. So how have you thought about it?
Yeah. So it did actually affect me. Not this particular instance, but I grew up like 3 miles from the US-Mexico border. So I was exposed to like really high levels of black carbon pollution when I was a little kid. And I think that it just changes how you think about the problem. And if anything, it puts you in a position to solve the problem in a way that others might not be, because you've had that direct experience. So I actually, I always look at these things as, how is this working for me, right? Versus any other way.
In terms of toxicity, I mean, forest fires don't bug me that much. Urban conflagrations do, right? So they're very different. And then there's a lot of people I work with who are fighting the California Pharmacy Board and a bunch of others who are making sure that there's access to glutathione, which you're probably aware of, and it really clears out toxicity, as well as phosphatidylcholine and a bunch of other things that are generally available, that I actually take that regardless of this factor. But like, I'm not leaving. It's just not going to happen. Fire's not going to stop me.
Just to add, though, there's layers to that question when you think about this. Even when I think about, there's, in this case, an episodic event. May not be episodic, right? We're going to see continued, the frequency, the intensity, fires is not going to go away, even if we took massive mitigation today. There's inertia in the system. It's going to get worse. So there's the event itself. There's the aftermath. In fact, often the aftermath could last for years. Reentrained particulate with toxics attached to that particulate you're inhaling and so on. So it's a complicated question. And then there's insurance and costs and impacts on family. On the one hand, I think, of course I'd say, well, it's complicated. And then it's, what can you actually do from that reentrained material? How far will increased filtration at home, for instance, take you? And so those range of issues, I think, all play into this. It's a great question, it's a complicated issue, and very individualized too.
So I've gotten this question a lot too. At the end of the day, it's very personal. I have been asked by people who lost their entire homes, decades worth of, belongings, memorabilia they've collected over, generations of generations of families raised in a particular home. Should we rebuild or not? They're asking me. I'm, just trying to treat their, medical symptom, not try to give them life advice. But you end up just realizing it's very personal. And for some people, the right thing to do is absolutely to stay and rebuild. And for other people, the right thing to do is absolutely to move somewhere else. And where's that somewhere else? Is it still in the neighborhood? Is it across town? Is it somewhere else in the state, or is it out of state? And then, the question is, how does that fit with your job, your, career path, your family obligations? So it's really, at the end of the day, super, super personal. And very different. So if I'm talking to an LAFD firefighter, this is their calling, and this is what they do. So whether they were exposed while working, or where they live, or both, this is their raison d'etre and their mission, right? So it really, really depends. And then also for the people who say, well, I'm moving, I just don't know where to. Where should I move to? And I look at a map that now, those of you in the room who've helped put these data together, and you sort of look at the map and where is the overlap of, wildfire risk, wildfire urban interface, and then areas where you can, raise your kids, get an education, have career opportunities. Those are all overlapping areas. So is it the right choice for every person to try to, be an escapist? Not for every person. Right, so it's a very personal choice.
There's a long answer here, but we're all chatting about this because it affects us all deeply. But the amount of people who've told me that they moved from X to Y and then it burned is ridiculous. It happens all the time. I've heard this so many times. I don't know where to go. So if you can fight. If you can't, I would agree. Some people have to go.
We have time for one more. I saw you two back here earlier. I'm going to make you fight over which one wants to ask the question. I'm just going to set it right here in the middle, whoever wants it. Okay.
Hi, I'm Gina Kodos. I am a sustainable urban planner working with cities in California. And we're working on climate adaptation and action plans. And I'd love to hear about, for each of you, maybe your dream list of policies that cities can incorporate into their local planning measures for climate resilience or disaster relief that's been based off of your research or your experience working with community members, thinking specifically about Davita's work with West Oakland community members. Is it relevant?
My question's pretty unrelated.
Sorry.
That was a great question.
I think Sonoma County is actually a pretty good role model for this. My friend Mitchell will speak to that. They've, after the Tubbs fire, they made a lot of drastic changes. Same thing happened after the Oakland fire. What I'm hearing about Altadena is they're pushing rebuilds through in a way that they should not be doing. And so repeating yourself is just, it's crazy. And you can still use timber construction. There's just many, many ways to do this safely. And so I think there are decent models out there. It is not Altadena, unfortunately. Look at Sonoma County, for example. Not the best, but they're doing much better. We're going to see a lot of interesting change. I was just talking about that with my CTO in the back about there's a ballot measure in Berkeley about not having any vegetation within 0 to 5 feet. People are going to lose their mind. They love their rhododendrons and it's a part of their life, and I get it, but like we have to figure out ways to live with this environment properly. And I think looking at good role models is my answer. So Sonoma's a good place to start.
I can't claim to be a policy person. Anything that improves the health of my patients and our, the population served by our health system is fine by me. But I look to the experts down the row here for that guidance.
Yeah, I think, what was really powerful about West Oakland and what we see in communities across California is the desire to be self-determining. So, I think that we're in a moment when we're going to have to do a lot of things that don't feel natural, right? Trust communities, trust them to take on these different aspects of self-governance, despite the dangers, right? Because I think that's the only way we're going to actually be able to move fast enough and at the scale that's needed, because right now I don't think we are.
I'll touch the planner's question because you got a tough job. You got a tough job. Much of what a strong element of what we're talking about is partly catalyzed by sprawl. Much of what we're talking about from a public health standpoint, a significant contributor is transportation, right? And we have a huge housing problem, and most people spend inordinate amount of time in their vehicles. They actually don't want to. They actually have to have the kind of lifestyle they hope to lead. And the tax incentives in terms of build and sprawl and what those look like, it's infill development. Hard, easier said than done. And it's a closer proximity to where people live, work, and play. I mean, which most people want and can't, for various reasons, enjoy or afford that lifestyle. I think these things are complicated. They're all connected.
Okay, I think that was it, right? Thank you everybody for being here. Thank you to our panel. That was great. And feel free to mingle, grab bubbly water, whatever you want to do. We'll talk, but thanks everyone for coming. That was great. Thank you.